In 2013, a young woman, 31 years old, woke up at 2:30 in the morning in fear. Her hand and arm had gone numb, she was losing feeling in part of her face, and was having what she could only describe as heart palpitations. She immediately Googled her symptoms to find that they were consistent with that of a stroke. Panic struck her as she feverishly called her daughter's pediatrician. She said, "I texted my pediatrician. It's my kid's pediatrician, but it's the only person who will answer me at 2:30 in the morning." After a trip to the hospital and one MRI later, the young woman discovered that it was not a stroke, but it was, in fact, carpal tunnel and the side effects of a panic attack. The woman in the story is Jessica Alba. The actress has played in several movies, such as The Fantastic Four, Sin City, and Good Luck Chuck. Jessica described her symptoms on Jimmy Kimmel Live, saying, "It was dead. I couldn't move it. My whole arm went numb. I got cold sensations in the back of my neck to the front, and I couldn't move my face." With a number of bones, ligaments, nerves, and blood vessels running through the wrist alone, it comes as no surprise that things can get a little cramped. On the anterior side of the wrist, bones and ligaments form what is known as the carpal tunnel. Running through the tunnel is the median nerve. At times, compression of this nerve can occur from swelling due to trauma, arthritis, water retention as in pregnancy, diabetes, anatomical variation, overuse, and a number of other contributing factors. Individuals who have suffered from carpal tunnel syndrome have been depicted in surgical literature since the mid-19th century. Sir James Paget was the first to make note of nerve compression in a distal radius fracture. During the early 20th century, there were multiple cases of nerve impingement beneath the transverse carpal ligament. In 1939, the term carpal tunnel syndrome was first noted. Shortly following, physician Dr. George S. Phelan identified carpal tunnel syndrome as a pathology following a patient study in the 1950s and 60s after World War II. While there is no consensus on the standard for referencing a diagnosis of carpal tunnel syndrome, there are a few tests that can offer physicians and physical therapists a nod in the right direction. One of these special tests is Phelan's maneuver. Phelan's maneuver is done by flexing the wrist gently as far as possible and holding the position while waiting for symptoms to arrive. Another of these tests is Tyndall's sign. This test is performed when a physical therapist begins light tapping at the center of the carpal tunnel and works approximately up the forearm. This may cause a tingling sensation. As a side reference, a patient experiencing true carpal tunnel syndrome will not show any signs of numbness over the base of the thumb or bulge of the muscles in the palm. This is because the branch of the median nerve, which innervates that particular area, passes over the carpal tunnel rather than through it. This may help the physical therapist or physician distinguish between carpal tunnel syndrome and thoracic outlet syndrome. As the median nerve becomes pinched, it can cause tingling in the thumb, index, and middle fingers. Patients may also experience weakness due to numbness. The symptoms are most often felt when using a gripping motion such as grabbing a doorknob, grasping the steering wheel, or holding a phone. Many times, secretaries may also experience carpal tunnel after devoting many hours at the computer using the keyboard or mouse. This can be caused from overuse or resting the wrist joint against the keyboard pad. In fact, this is what Jessica Alba attributes her carpal tunnel to. The actress states that she spends hours a day managing her online company, The Honest Company, from a computer desk and believes that endless hours at a computer may be the cause for her carpal tunnel. While surgical approaches are an option, non-surgical approach is recommended by most doctors. Physical therapy done to relieve the median nerve and glide it out from the inflammation has been proven to be one of the most effective means of release. There are many progressions to the medial glide. All progressions include alternating between neutral or wrist flexion and wrist extension in order to glide the nerve out. Some may simply include flexion at the wrist with no additional movement. Some glides can be done with a wall. and may use the head to cause tension and relaxation on the nerves. This can be done because of the nerve origin from the brachial plexus. Other treatments of CTS may include short-term use of non-steroidal anti-inflammatory drugs or cortisone injections for severe cases. As was the case with Jessica Alba, many people may also wear a splint. This can be worn to help brace your wrist and keep it aligned in a neutral position. A splint can help relieve the tension on nerves and tendons so that they can recover from stress. There are also a number of physical therapy exercises that can be done to increase strength and endurance in the wrist and hand. Such exercises include ball gripping and finger pinching. Ball gripping can be done with or without the thumb included in the exercise. Finger pinching can be done from finger pad, tip to tip, or a combination of the two. And as with all pathologies, patient education on pain management and prevention is a must. Although carpal tunnel affects nearly 8 million Americans, just like Jessica Alba, it is not a hopeless syndrome. With physical therapy, preventative knowledge, and continued awareness, carpal tunnel syndrome can continue to be treated and even relieved, bringing hope to sufferers worldwide.